Let's talk about the difference between the Canadian and the Philippine nursing practice with regards to confirming nasogastric tube placement. In Canada, in Sick Kids Hospital for example, I noticed that the nurse was testing the gastric contents pH using a pH strip to confirm if the NG tube was in the correct placement. Normally, the pH level of a gastric content is from 1.5 to 3.5. So, if the pH of the gastric content sample is within that range, it is safe to say that the NG tube is in the correct placement. According to study, a pH level below 5.5 of aspirated gastric content from the NG tube is a reliable indicator that the NG tube is in the correct placement, even if antacids are used. In contrast, in my nursing practice in the Philippines, I used to do the auscultatory method or injecting a small amount of air into the NG tube and listen for bubbling sounds using a stethoscope. It is common nursing practice in some areas in the Philippines to do the auscultatory method because it is cost-free. According to studies, nurses were taught to do auscultatory method during 1980s, and some nursing textbooks still suggest the use of auscultatory method. However, a study also suggests that auscultatory method is not reliable due to its inability to detect misplaced tubes. Therefore, the associated cost and availability of resources can affect the quality of care and may cause harm to the patients. As new generation of nurses, through the continuing innovation in healthcare, we should advocate for best nursing practice and promote patient safety. Let's talk about the similarity in nursing practice for patients with chest tube in the Philippines and in Canada. The nursing care for patients with chest tube in the Philippines does not remarkably differ in Canada, except for the chest tube being used. In the Philippines, some of the hospitals are still using the butterclass chest drainage system, whereas in Canada, it is common to use a water seal chest drain system. However, the principles of chest tube care are the same. For example, chest tube drainage system should remain below the patient's chest level. Tubing should have no kinks or obstructions that may inhibit drainage. And milking or clamping of the tube should be avoided. Therefore, the basic principles and the concept of nursing care will usually remain regardless of type of equipment or level of technology used. Since new inventions and discovery in healthcare continue to emerge, patient safety and quality of care should remain the paramount of nursing care.
Since the dawn of World War II, nurses have been taking care of wounded and sick soldiers. Historically, a typical nurse uniform consisted of a dress, pinafore apron, and nurse's cap. This type of nurse's dress continues to be worn in many countries, including the Philippines. The uniform made the nursing profession more distinguishable. And over time, the white uniform has evolved, but it has remained one of the symbols of the nursing profession. Beginning in the 1990s and until the present time, the traditional nurse uniforms have been replaced with the new scrubs in some countries, including Canada. Most hospitals in the US and Europe argue that the scrub uniform is easier to clean and maintain than the old nurse's uniform. In many parts of the world, nurses continue to wear a white uniform consisting of a dress and a cap, just like in the Philippines. They continue the tradition for several reasons, with one of the reasons being it commands respect and authority, displays professionalism, cleanliness, and purity. One of the other reasons is that the scrub uniform did not allow for differentiation between staff positions or departments. Meanwhile, today here in Canada, nurses can wear scrubs of any color or even any clothing that they are comfortable in. as long as it complies with their organizational policies. Almost all nurses wear some type of scrubs, whether working in a hospital, physician's office, clinic, surgical centers, or even dental offices. Thus, the wearing of the uniform depends on the culture and practice of the organization. For me, whatever you wear, be it white uniform, colored scrubs, doing your professional responsibility as a nurse is all that matters. Thank you. One of the many similarities in nursing practice between Canada and the Philippines is the observance of 10 rights of medication administration. Every nurse in the Philippines and in Canada observe these rights prior to giving the medications. The rights are the right patient, right medication, right route, right time, right dose, right documentation, right assessment, right client education, right to refuse, and a right evaluation. Thank you.
Nurses all around the world follows the same nursing theories and fundamentals in practice. Based on my experience during my placement as a nursing student in Canada and Philippines, staff nurses in these countries observe 10 rights in administering medication. Since nurses are primarily involved in dispensing and preparation, they are the front line of ensuring safety and quality of patient care in giving medication at all times. This is to avoid medication error, as there's no room of error in this nursing practice. Moreover, Canadian and Philippine staff nurses build intra-professional teamwork that strengthen their advocacy in giving safe medication. On the other hand, there are some practices in healthcare delivery system that differs from one country to another. In the case of Canada and Philippines, it is the interprofessional collaboration of doctor and nurses. Today, healthcare team is expected to practice interprofessional collaboration to achieve goal of delivering patient-centered, safe and effective care that meets the complex needs of the patient. According to World Health Organization, interprofessional collaboration occurs when multiple health workers from different professional backgrounds coordinate each other and provide comprehensive services by working together with patients, their families, caregivers, and communities to deliver the highest quality of care across the settings. Canadian healthcare delivery system observed the importance of interconnection and collaboration between the members of healthcare team. Nurses collaborate with doctors in making appropriate decision and management to patient care. They believe that patient care is interprofessional team-based perspective and nurses are champion in holistic patient care. This interprofessional practice optimizes the quality of care and lowering the cost of healthcare delivery as the healthcare team works together towards the shared goal that focuses on the patient. However, in the Philippines healthcare setting, doctor-nurse professional relationship follows the typical patriarchal and hierarchical system. Often nurses merely carry out doctor's order and expected to exhibit respect, act passively, trust, and never disagree with the doctor. This shows that nurse is seen as that of a handmaiden. There is a visible evidence that doctors work closely with nurses. However, doctors gives only order without discussing with nurses or considering their perspective in providing care to the patient. This poor interprofessional collaboration may negatively affect the delivery of health services and patient care that may lead to inappropriate care or error. In conclusion, doctor-nurse interprofessional relationship is poorly practiced in some countries. In the Philippines, teamwork is evident and may improve outcome of providing healthcare, but teamwork is not significantly same as interprofessional collaboration, which depict equality of decision-making powers and include voices of nurses in planning appropriate care to the patient. Interprofessionalism is critical for providing access to patient-centered care.